So let's talk about understanding your range of function in rehabilitative, restorative, and maintenance care. So we're going to explore various aspects of rehabilitative and restorative care in the role of the nurse aide in the process. Disease, injuries, and surgery are often responsible for the loss of a body part or the loss of bodily function. So working with the elderly and disabled requires a great deal of patience, caring, and understanding from healthcare workers. We have to work together to assist the residents to attain the highest possible level of functioning, and that can be very challenging, and it also can be very rewarding. So the body systems. Let's talk about the skeletal system. So the skeletal system comprises the bony framework of the body. We have 206 bones. The functions of the skeletal system are support, to protect movement, mineral storage, blood cell production. The joints are the point where bones meet. Immovable bones are the cranium. Slightly movable bones are the vertebral discs. And freely movable joints would be the shoulder, the knee, and the wrist. So the composition of ligaments, the ligament connects bone to bone, and the tendon connects muscle to bone. The bursa is the fluid-filled sac that allows bones to move easily over one another. The cartilage is the connective tissue that cushions the joint at the end of bones and between the bones. Some common disorders: osteoporosis is porosis of the bone that breaks easily, so it's a porous bone that will break easily. We often see this in the elderly. A fracture, so a fracture is a break in a bone. A simple fracture is a broken bone with the skin still intact. A compound fracture is again a broken bone, but the bone actually penetrates through the skin. A comminuted is a broken bone, and you have fragments of the bone in the tissue. And a green stick fracture is an incomplete break of the bone. Arthritis is inflammation of the joints. Osteoarthritis is due to stress on the joints, like when you have bone on bone, and it usually affects weight-bearing joints such as the knees, the hips, the vertebrae, and the fingers. Residents who have this usually have aching and stiffness and ultimately limited motion. Rheumatoid arthritis is a systemic disease. It causes inflammation, deformity, and oftentimes it's crippling. With rheumatoid arthritis, our residents may have painful joints, they may be stiff, their joints are swollen, and oftentimes they're red and warm to the touch. An amputation is removal of all or part of a limb. A sprain is stretched or torn ligaments or tendons. Bursitis is inflammation of the bursa causing pain on movement. So the effects of aging: bones are more porous or often brittle. The joints are less flexible. We see postural changes, awkward walking patterns, slowed recovery from position changes, and sudden movements. This affects blood pressure and heart rate as well. Things that you need to report are slow and unsteady body movements, difficulty holding objects, complaints of pain in the joints, swelling, redness, and warmth in the joints, and oftentimes an inability to move the joints. You need to make sure you report those. Complaints of pain with movement, complaints of neck or head pain that is different from normal for that resident. Resident who has fallen: if they fall, you need to make sure you stay with them and call for help. Do not move them or allow them to move. If our residents have casts on an arm or a leg, we need to make sure we report complaints of pain in the limb, swelling of fingers or toes, pale skin of the fingers or toes, cyanosis and coolness of the fingers or the toes, odor or drainage from a cast, inability to move the toes or fingers, complaints of numbness in those fingers or toes, and drainage from the cast. So let's move on to the muscular system. The muscular system provides the body with the ability to move. Over 650 different muscles comprise nearly half the body weight. The job of the muscles are to allow movement, help the body stay erect so we have good posture, produce most of the body's heat, gives our body the form and shape that it's in, and it also provides for movement of internal organs. Paralysis is some common disorders of the muscular system could be paralysis, which is the loss of voluntary movement due to neurological damage, such as a stroke or trauma. Multiple sclerosis, which is a weakening of the muscles due to loss of covering on the nerves that control them. And atrophy, which is muscle mass decreases in size. If you've ever had a cast on a body part, such as an arm or a leg, and when the cast is removed, you see that the muscle is a little bit smaller than the other one, that is also called atrophy. A contracture is a permanent shortening of the muscle. The joints become ankylosed, which means they're frozen. We can have muscle strain, which is damage caused by trauma. We also can have myalgia, which is muscle pain. Torn muscles can cause tear caused by trauma. The effects on the muscular system of aging is poor response to stimuli. We're slower. Pain when moving, therefore the muscles are not used as often, so we sit more. We're less active. Our muscle strength and bulk loss, we lose those. We have slower muscle-nerve interaction. Oftentimes difficulty holding or lifting objects, inability to move a body part, difficulty walking, and the loss of muscle strength and tone. Can also have edema of tissue or joint, complaints of muscle pain, generalized weakness and fatigue, slow and unsteady body movements. So let's move on into the nervous system. So the nervous system controls and organizes all body activities. It's divided into two parts, the peripheral nervous system and the central nervous system. The central nervous system consists of the brain and the spinal cord. The basic unit of structure is the neuron or the nerve cell, which is the most complex cell in the body. It does not reproduce. Therefore, if it's destroyed, it is not able to be replaced. Your nervous system enables you to speak, to hear, taste, see, smell, think, respond, and move, to learn, and to remember. The central nervous system contains the brain, and the cerebrum, the cerebrum is the largest portion of the brain. It is responsible for judgment, memory, association, and discrimination, and that's not based upon race. It's our ability to discriminate between two things, divided into left and right hemispheres. The cerebellum is responsible for coordination of muscles, balance, and posture, and muscle tone. The thalamus monitors sensory stimuli. The hypothalamus controls the autonomic nervous system, the cardiovascular system, body temperature, appetite, water balance, the GI system, sleep, and your emotional state. The pons is responsible for reflex actions like chewing and saliva production. The medulla oblongata regulates heartbeat, respirations, swallowing, coughing, and blood pressure. The spinal cord is approximately 18 inches long. It extends from the brain to the small of the back. The job is to carry messages to and from the brain. It relays messages to the body through the spinal nerves. It is also responsible for handling reflexes. The peripheral nervous system, the nerves leave the spinal cord and go throughout the body, responsible for digestion, secretion of glands, heartbeat, and breathing. Common disorders of the nervous system, a CVA, also called a stroke, or a cerebrovascular accident, where damage to part of the brain due to blood clot or hemorrhage cutting off blood supply. Head or spinal cord injuries, dementia from nutritional deficiencies, exposure to toxic substances, reduced blood flow to the brain, and sometimes unknown causes. Alzheimer's disease is a common cause of organic disease, which is a common disorder of aging and nervous system. Parkinson's disease is a progressive nervous disease associated with destruction of brain cells. Multiple sclerosis is the loss of the covering around the nerve fibers, interfering with nerve impulses to and from the brain. As we age, the effects on the nervous system include loss of nerve and brain cells, increase in your reaction time, changes in memory. The receptors become less sensitive, so they require increased stimuli for response. We can have a reduced sense of touch and sensitivity to pain, reduced blood flow to the brain, and forgetfulness. Things to report would be jerking motions, changes in speech, complaints of numbness, complaints of dizziness, complaints of nausea, confusion, complaints of loss of feeling on one side, be that right or left, incontinence, which is the ability to control your urine, deranged thought processes, tremors, muscular rigidity, complaints of visual disturbances or changes, paralysis, seizures. So let's move on into the sensory organs. So the sensory organs are part of the nervous system. Sensory neurons make you aware of changes in the environment. Changes are known as stimuli. The functions of the sensory system are your vision, hearing, the ability to smell, taste, and touch. Specialized functions of the sensory organs: the eye has the sense of sight, receives images and sends to the brain. The ear holds the sense of hearing and it transmits sounds to the brain. The nose houses our sense of smell. It allows us to recognize odors and improves the taste of food. The taste buds are on the tongue and they allow recognition of sweet, sour, bitter, and salty. Our skin allows recognition of objects, pressure, heat, cold, pain, and pleasure. Some common diseases of the sensory organs are cataracts. The lenses of the eye loses its transparency and it gets kind of a fuzz on it. Glaucoma is increased pressure in the eye due to an excess of aqueous humor. Conjunctivitis is an inflammation of the eyelid lining. A stye is a tiny abscess at the base of an eyelash. Otitis media is infection of the middle ear. Deafness, partial or complete hearing loss. Some of the effects of aging on the sensory organs: the lenses in the eyes become thick and cloudy. The sclera becomes more yellow. Less light reaches the inner eye, which decreases our ability to see. Hearing structures of the ear become less movable. And we also have soft wax production, which decreases. Progressive hearing loss of high-pitched sounds happens as we age. Peripheral vision and night vision decreases. The eye adjusts more slowly to changes in distance, and our sense of smell decreases. The sense of taste also decreases, losing the sweet and salty ability first. Accommodation to light and dark decreases. The sense of touch, heat, cold, pain, and pressure awareness also decreases. Things to report: the sclera suddenly reddened or yellow, the lenses of the eye becoming cloudy, complaints of pain in or around the ear or the eye, red, swollen eyelid, drainage from the eyes, complaints of difficulty seeing objects, comments that rainbows are apparent around lights, drainage from the ear canal, complaints of feeling of fluid or noise in the ear, complaints of sudden flashes of light or loss of sight. So rehabilitation is care that is managed by professionals to help restore a person to the highest possible level of function. Restorative care usually follows rehabilitation, and the goal is to keep the resident at the level achieved by rehabilitation. So rehab comes first, and then restorative care. So you have to make sure that we help our residents feel safe and secure by being kind, patient, positive, supportive, sensitive, to their needs and be helpful. So report and record with rehabilitative and restorative care any increase or decrease in abilities, any change in attitude or motivation, any change in general health, signs of depression or mood changes, or the progress or need for additional teaching. So emphasis is placed on existing abilities and encourage independence, and let's promote productive lifestyles. The goals of rehab and restorative care include prevention of complications, retraining in lost skills if we're able, and learning new skills. Training in self-care requires that 3 questions be answered prior to starting. What is the goal to be achieved? What approaches are used to help the resident achieve the goal? How will progress or lack of progress be measured? So resident self-care per their capabilities, include in goal setting process whenever possible the resident. Treatments are initiated by physical therapists, occupational therapists, speech therapists, and licensed nurses. Functional losses cause resentment and anger, frustration, withdrawal, depression, and grief in our residents. So your role: provide encouragement and reinforcement, praise all attempts at independence and overlook the failures, praise the accomplishment, help the residents see their progress. Be patient and allow time for them to do things themselves. Be sensitive and understanding, accept residents and encourage them to express their feelings. Show confidence in their ability. Review skills taught by us, allied health professionals, occupational therapy, respiratory therapy, physical therapy. Treat our residents with respect and help them to put their new skills into use immediately. Begin tasks at the resident's level of functioning. Assist them to do as much for themselves as possible. Be realistic and never offer false hope. Explain what the resident needs to accomplish and how you're going to help them. So ADLs are the activities of daily living, and the considerations for the resident to control how and when activities are carried out when they're able to. Use tact in making the resident aware of their hygiene needs. Encourage the use and selection of appropriate clothing. Be patient and allow time for slower paced activities. Provide for rest periods. Oftentimes just taking a shower wears a resident out. Assist to exercise and encourage the use of adaptive devices. So adaptive devices for assisting with ADLs can be special utensils to help them eat, electric toothbrushes for teeth brushing, long-handled brushes and combs for hair care, supportive devices to assist with walking such as canes, crutches, and walkers, wheelchairs and motorized chairs to help them move from place to place, prosthesis to replace missing body parts. Successful use of adaptive devices depends on the resident's attitude, acceptance of limitations, their motivation, and support from others. So ambulation and transfer aids, a walker is 4-point aid with rubber tips. The resident stands erect when moving the walker forward. The walker is adjusted to the height of the hip joint. The elbows are at a 15 to 30 degree angle. The walker is picked up and put down. It is not to be slid. The back legs of the walker are even with the toes, so the resident walks into the walker. The resident steps toward the center of the walker, and they always lead with their weaker leg. Let me repeat that. They always lead with the weaker leg. Canes. The types are the single-tipped, which is this one, the tripod, which has 3 legs, and the quad, which is a 4-point walker. It's used when weakness on one side of the body and the resident has use of at least one arm. Provides balance and support. should be fitted properly, which means the cane handle is at the level of the femur, which is the greater trochanter. The elbow is flexed at 15 to 30 degree angle, and the shoulders are level. Gaits are ordered by the physician or the physical therapist. You move the cane and the affected leg together. Then you move the cane, then the affected leg. It's used on the side of the body where the leg is the strongest, so it's the opposite side of the weak leg. Crutches provide support and stability through use of hands and arms. It's used when one or both legs are weak. Measured to fit properly by the physical therapist. The height is correct if 2 fingers fit between the armrest and the axilla. This is the armrest. The hand grip is adjusted to allow for a 20 to 30 degree flexion of the elbows. And there are multiple types of gaits for using crutches. A 4-point gait, a 3-point gait, a 2-point gait, a swing 2 gait, and a swing through gait. Crutches, the weight is supported on the handlebar, not on the axilla. Wheelchairs are available in different sizes and models to allow for proper fit and usage. They're cleaned with mild detergent and water and rinsed with water and then dried. Periodic maintenance is needed with 3-in-1 oil to ensure that the parts move appropriately. The armrests adjust to the appropriate height, and the feet rest flat on the floor when the chair is not moving. Seats should not sag towards the center of the chair. The seat should not reach back of the resident's bent knees. It shouldn't quite touch. The brakes are locked when the chair is not moving. Wheelchairs are guided backwards when going downhill. Wheelchairs pulled backwards over indented or raised areas. So the feet are placed on footrest for transport. Gurneys, stretchers, and litters. The wheels are locked when the transferring residents on or off of them. Safety belts secured prior to transfer. Both side rails are raised prior to transfer. Residents are never left alone on the stretcher. The backed head goes into the elevators first. Always use with assistance when transferring a resident on or off, and the pushed feet go off first during transport, so you push feet first. And of course, guided backwards when going downhill, because you don't want the person to slide out. They're cleaned with mild detergent and water and rinsed with water and dried. Gait belts as a transfer aid. They're used for the residents who are unsteady on their feet. It protects our resident who loses their balance or possibly could faint, and they're held in the back. They have to be tight enough to provide support, but loose enough to be comfortable, and they're used to safely transfer our residents. Correct aids must be used because they are individually fitted. The resident is observed closely to be sure aids are being used as ordered. Faulty equipment is reported and not used until it's repaired. So one of the things that we all have as an ambulatory device are our shoes. Our shoes must fit and be in good condition, and if you see skin breakdown, it must be reported. Make sure that the rubber tips on the walkers and the canes are in good condition. Mechanical lifts. So, the U.S. Department of Labor Hazardous Order Number 7 states that this order prohibits minors under the age of 18 from operating or assisting in the operation of most power-driven hoists, including those designated to lift and move patients. So what do? Regardless of your age, you have to show me competence in the classroom. Under the age of 18, you must not lift or use the lift in the clinical area. Mechanical lifts are used for the transfer of residents. You lower the end of the sling, which this is a sling. It's positioned behind the knees, and the hooks are turned away from the body. Straps, sling, and clasps checked for defects. Enough assistance is available to assure safe transfer. Areas checked for safety hazards prior to the transfer, which means you need to walk around and make sure that everything is safe around the bed. So joint mobility needs. Types of range of motion. ROM is range of motion. So active range of motion, the resident exercises joints without help. Passive means another person moves the body part or the resident. So the purpose of range of motion is to maintain muscle tone, prevent deformities, increase circulation, and encourage mobility. As you perform range of motion, you need to expose only the part of the body being exercised. Be gentle and stop if the resident complains of pain. Make sure that you use good body mechanics for yourself. Follow directions from a supervisor on the number of times each joint is to be exercised and how to perform exercises safely based on each resident's condition. Each movement is repeated 3 times unless otherwise ordered. Support the joint as it is exercised. Report complaints of pain or discomfort to the supervisor, which means you need to tell the patient, if anything that I do causes you pain, please let me know. Exercise the joint slowly, smoothly, and gently. Do not exercise swollen, reddened joints. Report those conditions to a supervisor. Some of the words that you will need to know are abduction, adduction, extension, hyperextension, flexion, plantar flexion, dorsiflexion, and rotation. Pronation, supination, eversion, inversion, radial deviation, ulnar deviation. So let's move on to prosthetic devices. So some of the prosthetic devices can include an artificial eye. Encourage your resident to remove and clean and replace the eye prosthesis if they're able. Eyeglasses. The lenses are made of glass or plastic. They're stored in a preventative case to prevent damage when they're not in use. They are held by the frames. They're washed under running water using mild detergent, rinsed with clear water, dried with tissue or a soft cloth. The tops of the ears and nose need to be observed for redness or irritation from glasses. Make sure you wash your hands before and after cleaning the glasses. Contact lenses can be hard or soft, and you can encourage your resident to care for their own lenses. Unusual observations where contact lenses are concerned that need to be reported are redness, itching, swelling, complaints of pain, blurring of vision, or scratching sensations. Hearing aids, the earpiece is cleaned daily with soap and water. This is the only washable part. The earpiece and tubing should be soft. Wax cleaned from the tubing with special equipment. Batteries need to be checked for power. Skin needs to be observed for redness or irritation in or around the ear. Earwax buildup needs to be reported to a supervisor. Inserting the hearing aid, turn the volume toward the maximum until the whistle is heard. Replace the batteries if the whistle cannot be heard. Then turn the volume to low setting. Gently insert the earpiece into the ear canal and adjust it for comfort. Loop over the ear for over-the-ear models. Adjust the volume to the resident's satisfaction. When you remove the hearing aid, turn the volume to the lowest level or off. Gently lift the earpiece up and out of the ear and use tissues to wipe the earwax off of the ear. Store in a safe place and remove the battery when it's not in use. Braces. The braces are used to support a weak part of the body, prevent movement of a joint, correct deformities, and prevent deformities. They can be made of metal, leather, plastic. Bony parts under the brace require protection in order to prevent skin irritation or breakdown. Report any wear noticed and when the brace parts are loose or missing. So custom fitted shoes, watch for broken shoelaces, heels and soles that are worn, leather that is worn or torn, and damage from perspiration, which includes odors and stains. So an amputation is a partial or complete removal of a body part. It's usually an arm or a leg. The below the knee is the most common, also called a BKA. Examples of prosthetic devices include artificial leg, foot, arm, and hand. Prostheses are fitted and made for each individual, must be handled with care and stored in an appropriate place when not in use. Make sure we have the right device, check all the parts for damage, evaluate the resident's limb for irritation and swelling, pad the area of the prosthesis when touching the resident, clean according to the instructions, and report any needed repairs to the supervisor. So following the removal of a breast, oftentimes women have prosthetic breast forms. Assist female residents with adjustment of the forms when they get dressed, and follow care by the manufacturer's instructions. Keep the forms separate and in a safe place when handling clothing and laundry. So body mechanics for our residents, we need to make sure that they have a broad base of support, which leads to better balance and stability. Keep weight the same on both feet, and stoop using the hips and the knees. Keep the back straight. Lift and carry objects close to the body for better balance. Use both hands to lift or move objects. Use smooth and even movements. Do not bend or reach. If injury is possible, always ask for help. Do not twist the body to reach an object, and keep the body in good alignment.